that will be helpful in inflammation and pain management. Now, this is coming from a person that is very accomplished. Dr. Surabhi is MD. She's a postgraduate in medicine, and on top of that, she has an advanced training in pain management. And that's years and years of experience and education coming to the wellness. So she's in very unique position to share tonight, and we are all blessed to be able to listen from her. So without taking,
absolutely, I'm very excited to listen from the expert.
Yes,
and we would like to welcome Dr. Surabhi.
And without taking much of our time, all yours, Dr. Surabhi. Mm-hmm.
Thank you so much, Kavalya and Devashri, for the generous introduction. I'm equally excited because this is the first time I'm presenting a topic related to my specialty to people who are not in medical background, many of them. So it is very challenging for me. I hope I'll make it as simple as possible so that you take some useful nuggets tonight. Can you all see my screen?
Yes.
Yes.
Okay. Okay. Actually, I can see only half of my screen. Okay.
Okay. Yeah, you can just present. Yeah. Mm-hmm.
Okay. So my topic is nutrition to fight pain and
excuse
inflammation.
me, Dr. Surabhi. Dr. Surabhi.
Yeah.
Can we record this, Kavalya? Yeah. Thank you.
Sure. Okay. So my topic is nutrition to fight pain and inflammation naturally. So when it comes to nutrition or diet, it is something we do every day in our lives. We can take in things which oppose inflammation or perpetuate inflammation. And we teach in my day-to-day practice in my clinic, I teach patients how to eliminate inflammatory factors from your diet and to take in things that will lead to to take out things that will lead to inflammation, and to take in things that will help your body fight inflammation. So diet is a very much the key actually to fight long-term or chronic inflammation, because you cannot be on painkillers for long-term for any disease, for any condition, for any chronic pain condition, because painkillers have a lot of demerits, a lot of complications, a lot of systemic side effects. So diet is definitely the key. But before that, let's understand very precisely what is inflammation actually. And just define it very simply, it is the immune system's response to a stimulus that is viewed as foreign or toxic to the body. So we call that as an antigen. So the body is responding to the attack of something foreign, which is an antigen. And it is a process dealing with the development of antibodies against that antigen. And in this process, we go through something called inflammation. Okay, so in very simple terms, inflammation is something which is very important for the body because it is a result of a defense mechanism. But then the problem arises when it becomes too much or chronic, or there is an imbalance in the inflammation. So, this is a very incredibly sophisticated and there's a complicated mechanism in the defense of the immune system. And there are lots of cells that take part here, like the T lymphocytes, the B lymphocytes, the neutrophils, the macrophages. And we have a defense mechanism when these cells come into play. And we get fever as a result of inflammation. And then again, when we have injury, suppose any part of our body gets injured, then the body tries to mobilize blood to that part, and that part becomes immobile, stiff, redness, there is swelling, there is a lot of histamine release. And this is a part of the repair process actually. And eventually, in this repair process, we get pain out of injury and inflammation. And pain actually, according to WHO, nowadays is the 5th vital sign. So you cannot ignore pain. So, we have an advertise which states, "Dard mein bhi kuch baat hai." So it's not that, we shouldn't think that it's part of our lives. We have to go with pain. We will have pain in some part of our body or the other, and we have to cope up with it. It's nothing abnormal. No, it's not like that. For every pain, there is a reason, and we have to find out that reason. And if we define what is pain in a very simple terms by WHO, it is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Okay. Now, I was talking about the defense mechanism. In this inflammation, we get a chemical in our body, which is called histamine. And this histamine causes congestion, warmth, redness, swelling, and, it causes pain. Now, where from this histamine comes from? We have some weapons in our body, which are some very weird sounding words like cytokines, prostaglandins, leukotrienes, tumor necrosis factor. And these are the controllers actually. They control the amount of inflammation to be triggered. So if these weapons that I talked about, the cytokines, prostaglandins, if they miscalculate or misfire, there is too much of secretion, there is too much of collateral damage. And that is where the problem of inflammation sets in. And that's what happens when we have an imbalance of the immune system. The overreaction causes diseases like all the autoimmune diseases, for example, asthma, allergies, inflammatory bowel diseases, SLE, etc., rheumatoid arthritis. And when there is an underreaction, we have this flaring up of different pathogens which attack our body, like the viruses, the bacteria, the parasites. So there has to be a delicate balance. Anything over or under reaction of the immune response system is very much harmful to the body. Now, why are we so much concerned about inflammation? Actually, to tell you the fact, in chronic inflammation is actually the cause of all the major systemic diseases of our body, be it renal diseases, cardiovascular diseases like coronary artery diseases, Alzheimer's, pulmonary diseases like asthma, allergies of the lungs, neuropathies, arthritis like osteoarthritis, cerebrovascular diseases, so many autoimmune diseases like celiac disease, Crohn's disease, rheumatoid, neurological disease, and last but not the least, the most important being the diabetes. So all of these diseases are actually a result of chronic inflammation which is going on in the body. So it is very important to identify triggers. What are the factors which are triggering inflammation in our body? So first of all, any kind of imbalance of the immune system always starts from the gut. So we always have to identify the food allergies first, because those are the allergens we are exposed to every day. And when it comes to food, there can be certain parts of your body which is allergic to a certain kind of food. Not necessarily the whole body is allergic to the food. And the most important allergens that we come across every day are, number one, processed dairy, nuts like peanuts, and gluten, which is present in wheats and grains. And it's very difficult to make patients understand that these are causing problems, actually, inflammation, which is if you consume in an excess amount. And it is not necessarily true for everybody, because everybody has a different genetic blueprint. So dairy, nuts, gluten, these are things which can cause inflammation. For example, gluten, maybe you may be allergic to gluten, and only your small intestine may be allergic to gluten. So that part of your body may have things like an ulcer, ulcerative colitis, maybe any kind of colitis. Itis is inflammation. So there may be, certain parts of your body which are allergic. So we need not have allergy of the whole body, a whole body swelling up to a certain allergen. So it really, we have to counsel a lot to the patients. We have to make them understand the mindset that these are causing. Next comes a very important trigger of inflammation, that is insulin resistance. And this condition causes a lot of inflammation, a lot of stiffness, and the cause here is sugar. I'm also talking about the hidden sugars like the bread, the juice, the pasta, the cereals, the sweeteners, and all the processed carbohydrates that we consume every day. And I myself suffered from insulin resistance in my late 20s and early 30s, and there was a time my body was inflamed and aches and joint pains and all. So this is a very serious condition. And the result is lethargy and a lot of systemic complications, ultimately leading to diabetes, and when the cells become resistant to insulin. And the only way to get rid of it is to take less carbohydrate at less frequent intervals. The next thing is, after insulin resistance, there is another term called cortisol resistance. Now, cortisol is actually an anti-inflammatory hormone. But again, there is, we have an imbalance in our body of cortisol, this cortisol resistance develops. For instance, in this Cushing's, where there's excessive cortisol and the cells start resisting to cortisol, just like insulin resistance. And there are particular features in our body which is very typical of Cushing's syndrome. Similarly, Addison's in the condition where body runs out of cortisol. It's a condition where there is low cortisol. The treatment is steroids. We give some synthetic steroids like prednisone. This is a disease where there is darkening of the skin and you have wasting and inflammation all over the body. And John F. Kennedy had this disease. And once you have this disease, you have to be on chronic cortisol treatment or steroid treatment. Then, the main factor of cortisol resistance or cortisol imbalance is stress. We have to eliminate chronic stress from our body as much as possible. Then another trigger of inflammation is old injuries. We might forget about old injuries. Suppose you fell down and got hurt in one of your joints and you forget it. But then your brain always keeps a blueprint of it. And those things keep coming back. There is an ongoing low-grade inflammation continuously in your body because of that old injury. And that leads to a chronic inflammatory state. As with old injuries, we have some other triggers that is continuously coming. One is oxidants. Now, in oxidants, we have sugar and junk food. And this elimination of these food triggers for inflammation is very important because it doubles the reactive oxidative radical production. So these are oxidants, all the free radicals that we take. We take antioxidants, but to counter these oxidants that we take, but it is better that we eliminate the oxidants as a whole from our diet. Another oxidant which we take are free iron, which is very corrosive. This is a dark side of iron actually. We are always exposed to iron, especially from low-grade, low-quality supplements, which we get synthetic free iron, which is available in the market. So it's really damaging. It has corrosive effect on the arteries, on the brain. So free iron is definitely a no-no. You should always go for a good quality iron. And you see in the Indian market, we have like iron fortified atta, which is again a free iron, which is very heavy on the gut. So we should try and avoid those factors. Next come infections. When we talk about infections, we know there are so many pathogens like viruses, bacteria, fungus. Our gut may be invaded by so many unfriendly bacteria. We might be having low-grade viral virus, attacking us. Now, of course, there is the coronavirus. And then we might have fungi like candida infections. Even a simple ongoing infection like a tooth decay is enough to get into the system, cause systemic inflammation, and even, cause coronary artery disease, or, heart. It bites the heart. That infection bites the heart. So that ultimately leads to inflammation, eventually leading to coronary artery disease or plaque formation in the arteries. So we should not take any kinds of ongoing infection lightly. They might be low grade, they might not be bothering us too much, but then of course we have to deal with them. And better than taking antibiotics, for these mild or low grade infections, I always prefer to take natural antibiotics like clove, thyme, oregano, even garlic. That is a very good antibiotic. Again, next trigger for inflammation is alcohol. We all know it damages the liver, and something that damages the liver obviously leads to inflammation. So we have to, take that in very moderate amounts. If at all we are taking it, better to avoid it. Next comes omega-6 fatty acids. So these are GMOs, basically refined oil, canola oil, sunflower oil. These fatty acids, they are the bad variety of omega-6. Now, we also have good omega-6 fatty acids like GLA or gamma linolenic acids, like the primrose oil, the blackcurrant oil, etc. But then we have to have a balance between omega-3 and omega-6, and we have to totally avoid these inflammatory omega-6 fatty acids from our diet. I mean, absolutely contraindicated. Now let's come to arthritis. Arthritis is a swelling of the joints, and the most common arthritis that we know is osteoarthritis and rheumatoid arthritis. Now, there is a myth that rheumatoid arthritis is inflammatory, whereas osteoarthritis is non-inflammatory. But osteoarthritis is much more common than rheumatoid arthritis. Rheumatoid arthritis is definitely an autoimmune disease. There is a rheumatoid factor positive in it. So definitely the inflammation part is much more in rheumatoid arthritis. But what people miss in osteoarthritis is they traditionally call it a non-inflammatory degenerative disease, which is not right. I've come across so many studies. One recent study from Alabama University, they stated that inflammation is one of the major causes of osteoarthritis, and people taking a low glycemic index food, a low carb diet, they have lesser incidences of osteoarthritis, or they have reversal. I mean, it's not that degenerative diseases are irreversible. There is the repair part. A body is made for wear and tear and then repair. So that both the things must go on simultaneously. It's not that once there is wear and tear, there won't be any repair. So we'll talk about the repair part, but by and large, these are both actually inflammatory conditions. So what are the causes of arthritis? Basically, we can call them poor mechanics, inflammation, poor nutrition, and poor circulation. So we have to take the best things, increase the nutrition and circulation. Obviously, when there is less building blocks in our diet, when there is less blood flow, there is a chronic inflammation going on, there is poor mechanics, definitely there will be increase in the arthritis. Now, if we come to the conclusion, like what is immediately in our hands to fight inflammation? We have weight loss, conditioning, exercise, and anti-inflammatory nutrition, which is of great potential when it is to fight inflammation. Now, coming to anti-inflammatory diet or autoimmune diet. I mean, what kind of a diet is it? Is it any fixed diet? Is it a low carb, low fat, high fat, Mediterranean, keto, or what is it? Actually, I wouldn't like to name it as such, because we have to know the principles, and then you can sort it out for yourself, actually, what is that anti-inflammatory diet. And the principles we follow in anti-inflammatory diet are low sugar. Sugar is the evil. I mean, there is no doubt about it. You have to eliminate sugar. Then grains, as I told, grains are people are very much sensitive to grains that we don't know, especially, raw grains, unsoaked grains. These are very, very sensitive. Our gut is sensitive to such things. Processed dairy and lowering of allergens. As I told, people might be allergic to different things, like even nightshades, like bell pepper, eggplant, tomatoes. So we have to identify the allergens of our body, and one person's food might be other person's poison. So it is very important that we identify what is the allergen in our food, and we have to eliminate that. Next, now what is the recommended diet? I would say we have to go for whole foods, because these have low GI, and we have to consume, add color to our plate through vegetables, lots of vegetables. And because they have flavonoids, carotenoids, we have to consume meat, saturated fats. Now, when you're talking about these meats, fats, oils, we're talking about quality, like grass-fed meat. We're talking about organic vegetables. We're talking about cold-pressed oils. So the recommended saturated fats, saturated fats are something which are very neutral for inflammation, very, very good for your body. And some of the good fats that you can include in your diet are eggs, then extra virgin olive oil, fatty fish like salmon, mackerel, some flax seeds, avocados, etc. These are very, very good for inflammation. And other kinds of quality anti-inflammatory food, which are very potent anti-inflammatory properties, are berries, broccoli, avocados, green tea, apples, sweet potato, dark chocolate, fatty fish, as I already mentioned. So this is the array of food that you should consume. Most importantly, you have to reduce stress, because cortisol excess causes inflammation in the body, and you have to keep that cortisol low. Never overstretch in your exercises also. Then adequate sleep, at least 8 hours of sleep is absolutely essential. Now coming to supplements. Supplements are so very important when it comes to inflammation, because it's very difficult for most of the micronutrients to be fulfilled with diet. First of all, because the quality of fruits and vegetables have deteriorated like anything, and to have them adequately in the diet, we are in a fast-paced life. Every day it may not be possible. Again, there are certain micronutrients which are almost impossible to get through the diet. So always we have to be careful. We have to go for quality organic supplements, very, very natural, plant-based preferably. And of course, Nutrilite is the brand that I would vouch for, the best quality supplements available today. And among the supplements, when it comes to fighting inflammation, the number one is vitamin D. Now, you remember I told you about this over and under reaction, imbalance of the immune system. Vitamin D is an immunomodulator. So it controls, it modulates inflammation. So it is very important. So anybody who is suffering from arthritis, fibromyalgia, asthma, allergy, any kind of inflammatory condition, vitamin D is a must in the treatment. Dose, I would say 20,000 international unit per day, can go up to 30,000. Then coming to joint health, glucosamine with boswellia is immensely helpful, because glucosamine is one of the building blocks of the joints, be it tendons, ligaments, cartilage, bones. Glucosamine is a must, and it's very difficult because to get it through the diet, because in Indian diet we hardly take fatty sea fish. So that is the most important source of glucosamine. So we had as no alternative. Same as for vitamin D. We don't go out in the sun much nowadays. It's almost important to, it's not impossible, almost impossible to get vitamin D from the diet. So we have to take it in supplement form. There's no alternative. And of course, calcium is must with vitamin D. Then salmon omega-3. Now, omega-3 is proved by many studies that it is an anti-inflammatory. It promotes anti-inflammation, vasodilatation, and it prevents clot formation, unlike omega-6, which does the opposite. So there are many clinical trials which says that people who take regular supplements of omega-3 have less incidences or the decrease in intensity or severity in rheumatoid arthritis, SLE, ankylosing spondylitis, etc., which are all autoimmune diseases. Again, since inflammation is a byproduct of immune imbalance, so immune health is of utmost importance. Tulsi, Nutrilite, vitamin C, all protein plant powder, and citrus concentrate. These are all very much important for the immune regulation. So, of course, we have to, keep in mind that folic acid, vitamin B6, all the antioxidants, vitamin C, probiotic, and deficiency of any of these micronutrients will lead to inflammation. So we have to have a balance of all the micronutrients, and so it is very much important that we take this in the form of supplements. If we are deficient, if we have low amount in the body, and then this is the way to go about to combat inflammation through diet and supplements. Thank you for your patient hearing. Thanks a lot.
Awesome.
Wow,
That was great.
amazing. Thank you, Dr. Surabhi.
Okay, guys, we're going to charge each one of you at least